Centers for Disease Control and Prevention revised its guidance on mask wearing this afternoon.
The CDC says fully vaccinated Americans should wear masks indoors in communities where COVID cases are surging. And the change comes as the Delta variant is sweeping across the country. UW Health Chief Quality Officer Dr. Jeff Pothof is back with us. Dr. Pothof, good to see you.
Good to be here with you.
So why is the CDC doing this and why now?
Yeah, so I think one of the things that we're learning about Delta variant is even those folks who are vaccinated, who get those rare breakthrough cases, they can actually transmit the virus and infect other people. Back when the CDC removed the mask guidance, we had good studies from Israel and other places that said if you're vaccinated, your risk of getting other people infected is really low, and Delta's starting to change that. So in areas where vaccination is low, so lots of people who could be infected, and cases are high, lots of opportunity for vaccinated people to come across Delta, starts to make sense where maybe we cover up those vaccinated people so they don't make unvaccinated people really sick, and we don't give this virus continual chances to mutate into a variant that defeats our vaccines.
So the breakthrough patients show some symptoms, so you know you have it.
Yeah, I mean, there might be some who have really mild symptoms. They might blow that off, but I think that's a good kind of lesson to those of us who are vaccinated. If you have symptoms that might be a cold or COVID, don't blow that off. It could be COVID. It's not likely it's COVID, but it might just be. Go out and get tested.
So if you get tested, if you're fully vaccinated and you get tested and you test positive, should you quarantine at that point?
Yeah, you know, at that point you likely can infect other people, so then you would want to isolate yourself so that you're not able to pass it on to other folks. That would be the recommendation. Now, this doesn't happen often. There's not very many vaccinated people who have breakthrough cases, but we are seeing more of it with Delta in the community. We didn't see this almost ever with those previous variants with normal coronavirus, but with Delta, it's causing that.
And what if you're fully vaccinated and you're exposed to someone who tests positive? Same rule applies?
Yeah, not so much. So if you're fully vaccinated and you're exposed, the rate of us seeing breakthrough cases are so low where you don't have to quarantine at that point, but you do want to monitor for symptoms. Just have in the back of your head, hey, I was exposed. I've got a really good chance of doing fine with this, but if I do develop some symptoms, I'm going to start isolating myself, get tested.
And just a few moments ago, Dane County Public Health recommends masks indoors, even though we're not under the CDC guidelines. We're moderates.
Yeah, our rates are moderate right now, and we do have a really good vaccination culture in Dane County, so that's helpful. You know, at the same time, I think as all this guidance comes out, we have a whole bunch of people coming to town for CrossFit. I can see some logic that says, you know what, while we're figuring this out, let's just make a recommendation that folks in indoor settings put that mask on. No harm in that, and it might come out to be a good decision in the end.
The COVID protocols at CrossFit Games are pretty intense, but I'm wondering, after what we saw at the Bucks Welcome Home Parade and just the masses of humanity, even in the Deer District.
The Deer District, right.
During the game.
85,000 people.
Are we expecting to see a surge after that?
So I think you'll for sure see some cases coming out of the Deer District, the celebration parade. I think the real question that remains unanswered is those events are outside, which is helpful. Some of those people were vaccinated. How do those things work together, and then how many cases do we actually see? Do we actually see a perceptible bump down in that Milwaukee County area? Or does it kind of get lost in the noise just because being outside and the rate of vaccination was high enough to avert any big spike in cases?
So as we sit right now, should we be wearing masks indoors?
You know, I think in Dane County, we have to figure this out. Per the CDC guidance, not necessarily. At the same time, we're learning more about the Delta variant. We're learning that it can cause breakthrough cases. You know, next week when we're talking, we very well might be masked.
Well, that's been the story all year. It's been evolving all the time and changing all the time,
Just
every day.
Get the unvaccinated convinced to get a shot.
Yeah.